Risk in 20-40 years, a gynecologist told what a paratubal cyst is. If the size of the paraovarian cyst is not large, it will not prevent the conception of a child and, as a rule, does not cause symptoms. A paraovarian, paratubal, cyst occurs in case of a violation of the process of embryonic development, is not an ovarian cyst and is not anatomically associated with it, although it is in close proximity. The predominant age of appearance of a paraovarian cyst is 20-40 years. It is located between the ovary and the tube. The gynecologist told about this on her page on the social network. It is worth saying that this cyst does not become malignant, but according to ultrasound, cystadenoma can be confused with it, and this is a completely different matter, the doctor noted. According to the gynecologist, a paraovarian ovarian cyst will never go away on its own or with the help of medication. The growth rate and size are completely individual. If the size of the paraovarian cyst is not large, it will not prevent the conception of a child and, as a rule, does not cause symptoms. Therefore, paraovarian cysts are operated on in cases where they are large. If they cause pain. If laparoscopy is done for another reason, such as infertility. Drug, phytotherapeutic and homeopathic treatment of paraovarian ovarian cysts is not used. Under the influence of physiotherapeutic procedures, it also does not regress. Since such an ovarian cyst develops in women of reproductive age, the only justified method of its treatment is laparoscopy. Surgery does not adversely affect a woman's fertility. After the operation, the pressure of the mass formation on the ovary stops and the reproductive function is restored. Also, paraovarian cyst does not affect the hormonal background. Does not cause the formation and exacerbation of acne. Does not affect the growth of hair on the head and body. Does not delay menstruation. Does not cause intermenstrual bleeding. Does not contribute to the lengthening or shortening of the period of menstruation and the volume of menstrual blood. There are a number of factors that contribute to the growth of a paratubal cyst. Sunbathing. Local hyperthermia. Thermal baths. As for the size, they can vary from small to giant, 1.0 to 30.0 centimeters in diameter. Cysts 0.5 to 2.5 centimeters in diameter do not cause discomfort and are most often an accidental finding during ultrasound or laparoscopic studies. But the diameter of the symptomatic, complaining, cyst is most often 5 to 15 centimeters. In the presence of a paraovarian ovarian cyst, a woman is recommended. Limit physical activity associated with a sharp change in body position and straining, rotation, somersaults, jumps and falls. Refrain from extreme sex. Do not take thermal procedures, common baths, saunas and baths. Refuse to visit the solarium and natural sunbathing. Do not ride horses.